Hello everyone. Welcome to this concise guide on musculoskeletal problems in a community pharmacy setting. Let's begin with muscle pain, also called myalgia. This is a common condition, often resulting from strenuous activity, exercise, or physically demanding tasks such as gardening. The pain arises due to microtrauma and inflammation of muscle fibers, which triggers local irritation and discomfort. While typically self-limiting, muscle pain can interfere with daily activities, and appropriate management is essential in community pharmacy practice. Topical therapy is often the first-line approach for localized muscle pain. Non-steroidal anti-inflammatory drugs, or non-steroidal anti-inflammatory drugs, such as ibuprofen, felbinac, ketoprofen, piroxicam, and diclofenac, can be applied directly to the affected area. They reduce inflammation and pain with minimal systemic exposure, thereby lowering the risk of gastrointestinal side effects. Counter-irritants, also known as rubefacients, are another option. Agents such as methylsalicylate, menthol, camphor, nicotinates, and capsicum produce mild irritation or warming of the skin. This sensation distracts the nervous system from pain signals and provides symptomatic relief. For best results, massage the topical preparation into the affected area to enhance blood flow and absorption. For moderate or widespread muscle pain, oral analgesics or non-steroidal anti-inflammatory drugs may be indicated. Examples include ibuprofen or diclofenac. These agents reduce systemic inflammation and provide broader pain control. When recommending oral therapy, always consider patient factors such as gastrointestinal, renal, or cardiovascular risk. Short-term use at the lowest effective dose is preferred. Combining pharmacological management with rest and gentle stretching improves outcomes. Next, back pain, which can involve muscles, ligaments, or tendons. Lower back pain is very common, often resulting from strains due to awkward lifting, bending, or prolonged gardening. In most cases, lower back pain is mild, self-limiting, and manageable with over-the-counter therapy. However, middle and upper back pain, or pain that persists, may indicate underlying pathology such as kidney disease or structural lesions, and requires referral. Management of uncomplicated back pain includes lifestyle modifications such as maintaining good posture, regular exercise, and weight management. Pharmacological options include oral non-steroidal anti-inflammatory drugs or acetaminophen. Topical sprays or gels are especially useful for patients managing pain at home alone, as they do not require assistance for application. Combining lifestyle advice with analgesic therapy optimizes pain relief and supports functional recovery. Referral is required under certain conditions. These include middle or upper back pain that persists, pain radiating to the legs or interfering with mobility, and lower back pain that continues for more than 1 week despite conservative management. Additional red flags such as fever, neurological symptoms, or urinary abnormalities should prompt immediate medical assessment. Next, we have bruising, which is the accumulation of blood under the skin following trauma. While usually minor, easy or spontaneous bruising may indicate an underlying hematological disorder or drug-induced bleeding tendency, for example from anticoagulants, antiplatelets, or corticosteroids. It is important to ask patients about frequency and severity to determine if referral is necessary. Management of bruising can include topical agents such as arnica gel or cream, which may reduce local inflammation and bruising. Vitamin K creams may support local clotting. Some enzymatic preparations, including heparinoids or hyaluronidase, are theorized to disperse fluid and reduce swelling, although clinical evidence is limited. Cold therapy immediately after trauma can further limit bleeding and swelling. Painful joints are commonly seen in pharmacy practice. The most frequent cause is osteoarthritis, a degenerative joint disease caused by wear and tear, which leads to joint pain and stiffness. Another cause is rheumatoid arthritis, an autoimmune condition in which the body's immune system attacks joint tissues, causing inflammation and systemic symptoms. Accurate differentiation is important for treatment selection. Management of osteoarthritis includes glucosamine, typically 1,500 mg once daily, with treatment review after 2 to 3 months to assess efficacy. Topical or oral non-steroidal anti-inflammatory drugs, such as diclofenac or ibuprofen, are used to relieve pain and reduce inflammation. Non-pharmacological measures, including exercise, weight management, and joint protection strategies, are essential. Always counsel patients on potential adverse effects, especially with systemic non-steroidal anti-inflammatory drugs. Finally, for acute strains and sprains, first aid follows the RICE principle. Rest the affected limb to prevent further injury. Apply ice or cooling within the first 24 to 48 hours to reduce swelling and limit tissue damage. Compression using elastic bandages helps control edema, and elevation above heart level reduces blood flow and swelling. Analgesics may be used to manage pain. Early intervention promotes recovery and minimizes long-term functional impairment. Topical NSAIDs and counter-irritants are effective for localized pain. Advise patients to avoid applying these products on broken or irritated skin to prevent further irritation or systemic absorption. Oral NSAIDs should be used short-term at the lowest effective dose. Monitor for potential gastrointestinal, renal, and cardiovascular adverse effects, especially in patients with comorbidities. Massage enhances the efficacy of topical preparations by improving local blood flow and absorption, and can also provide symptomatic relief. For acute strains and sprains, remember the RICE principle: rest, ice, compression, and elevation. This is first-line management and helps reduce pain and swelling. However, patients should be referred if pain is severe, mobility is significantly affected, or recovery is not progressing as expected. Finally, be alert to red flags that require referral: persistent back pain, neurological symptoms such as numbness or weakness, unexplained bruising, or unusual joint swelling. Recognizing these signs ensures patient safety and timely medical intervention. This concludes our overview of common musculoskeletal problems and symptoms management in community pharmacy practice.